Today I want to talk to you about the difference in the treatment of neurotoxins with Botox or Dysport or Nutox or Jeuveau for male and female patients. And there has to be done in different ways to achieve the result that each individual person is looking for. The muscles that we usually treat are the ones in the glabellar region, which is the muscles in between the brows. Also the forehead muscles and the muscles around the orbit. In guys, you want to keep some sort of movement so that they have some masculinized features still after treatment, but they look more relaxed. We still treat the glabella and the forehead and the crow's feet, but although they require more units per area in general, you do want to keep some movement most of the time. The important thing is the position of the brows. So for female patients, we aim to look for elevation of the lateral brows, but in guys and then male patients, we try to keep the brows more even. Therefore, the treatment has to be done in a different way for female versus a male patient. So for example, for a female patient, we want to treat the area in between the brows, and that will be the procerus muscle. Sometimes we have to treat also the nasalis muscle here, which basically will cause the bunny lines. And we also treat the corrugator muscles, and this will relax the central portion in between the brows, the 11th, which is commonly known as. But we also want to treat the central forehead. The reason we treat the central forehead in a particular way with like a little cross here is so that the lateral forehead, even though I also treat so that the patients don't get a Spock look or those eyebrows are arched significantly, you got to treat it, but you got to treat it in a less or minimal dose so that they still have some movement and they can have actually elevation of the brow, which is what females look for. On the other hand, when we treat male patients, we want to treat similar areas in between the brows, forehead, crow's feet, but we want to keep some sort of movement. For example, in a guy will treat the glabella or in between the brow area, also the procerus, the corrugators, and even though they require a higher dose because the muscles tend to be stronger, we want to do it in a way that you keep some sort of a movement in that area. When we're treating the forehead in a male patient, we want to make sure that we do it in a way that it's going to keep their brows even. Guys don't want to be walking around with elevation of the brows laterally. They want to have their brows more even. That will create a more masculine look. And basically we got to treat it in a different way. So we basically treat it more even rather than being too high of a dose in the center. We distribute that treatment more even across the forehead, being also very conservative because you don't want to also cause droopy eyebrows. And another important concept for male patients is when we go ahead and treat the crow's feet, you want to have an improvement on the crow's feet, but you want to keep some sort of movement in that area as well, because it once again it will keep some of that masculine look that male patients want to keep. They don't want to you don't want to feminize a male patient's face. And those are the things that we do different to treat female patients versus male patients with neurotoxins.